Hello and welcome to the Compass webinar. For those of you who just joined, we will be beginning in about 8 minutes. Hello and welcome to those who just joined. This is the Compass webinar. We will be beginning in about 7 minutes. Hello and welcome to the Compass webinar. We will be beginning in about 5 minutes. Hello and welcome to the Compass webinar. For all of you who have recently joined, we will be beginning in about 3 minutes. Hello and welcome to the Compass webinar. We will be beginning in about 1 minute. Hello and welcome everyone to the Compass webinar, our first webinar of 2017. How will the national elections impact the Affordable Care Act in 2017? And this is Eric Bricker. I'm the Chief Medical Officer of Compass Professional Health Services, and I'm so excited to be able to speak with you today. We have many wonderful existing clients on the phone. We have some prospective clients on the phone. We have a lot of the broker and benefit consultants that we work with on the phone. And we have a lot of new broker benefit consultants who we've recently gotten to know who have joined as well. So welcome to all of you. And let's dive into just briefly my background. So there's a picture of yours truly. And I am a general internist. I'm a primary care physician. As many of you know, I did my residency training at Johns Hopkins Hospital in Baltimore, Maryland, medical school at the University of Illinois. And before I went into medicine, I used to be a hospital finance consultant. So I used to be back in the billing office of major medical centers dealing with all the same claims issues that employers and insurance carriers have to deal with. But I was on the flip opposite side. I was on the doc and hospital side of claims because, believe it or not, docs and hospitals have a lot of trouble getting paid, so they hire outside consultants to come in and help them do that. And so had wonderful claims experience, but wanted to be more clinically oriented, so went on to medical school and residency, and just saw a lot of frustration and confusion with my patients at the bedside. So along with one of my consulting colleagues, we said, well, look, as doc and hospital insiders, we know sort of the ins and outs and the traps of the healthcare system. It would be so valuable if we could take that out to the world, and we wanted to bring that to employers and employees and their families, and that was really the beginning of Compass Professional Health Services. And I also write a blog, you can see there at the bottom, that's won honorable mention a couple of times. And we also have a healthcare price transparency group on LinkedIn that is over 2,400 members and is growing on a weekly basis. And you can actually receive blogs through that group or by subscribing to the blog as well. Just briefly about Compass. So Compass is your champion for simpler, smarter healthcare for employers and their employees. We've been doing this, founded in 2005, been supporting clients since the summer of 2007, so almost 10 years now. Over 2,000 employer clients, many new clients that started on January 1 of this year, so we're super excited to have them. Means over 2 million members across those employees and their family members, and we provided over 1 millionth solution this past year, and so helping people navigate the healthcare system over 1 million times. We have learned 1 million nuances that we then integrate into our software and into our systems to help people on a go-forward basis. You can see some of the names, household names of our clients down below: T-Mobile, Southwest Airlines, Dillard's, Sabre runs the software for about half the airline industry. Atmos Energy is the nation's largest natural gas utility. Chili's and Maggiano's Restaurants and Sprinkler International is that symbol right there. The city of Fort Worth, we've got quite a few municipality clients, actually over 55 municipality clients. Michael's Arts and Crafts Stores, I'm sure you're familiar with them. Many other great names as well, many other fantastic clients. Many of you are on the line, so certainly appreciate that partnership and the opportunity to work with you. So, as is all over the news and social media, the new election, and specifically, what does that mean for healthcare and the Affordable Care Act? So, the challenge, Obamacare, aka the Affordable Care Act or PPACA, created a lot of havoc for employee benefits professionals when it was passed in 2010 in terms of drastic administrative and bureaucratic changes that needed to happen on your parts and on the employee benefits and brokers' parts. However, its days may be numbered. Whether or not it's going to be repealed, it certainly is most likely going to change. But we're going to exactly talk about that change during this webinar. So, how will the national elections impact the Affordable Care Act, and what does this mean for employee benefits professionals? Okay, so believe it or not, many of you are aware of this. There actually were prior attempts to repeal the Affordable Care Act during the Obama administration, and it was actually called the Restore Americans Healthcare Freedom Reconciliation Act of 2015, and it was passed by the House and the Senate, but it was then vetoed by President Obama. So that act in 2015 is actually a fairly good picture of what future legislation might look like. So what was in the Restore Americans Healthcare Freedom Reconciliation Act of 2015? One, it removed expanded Medicaid coverage. Two, it eliminated insurance exchange subsidies. Three, it ended the tax penalties for people without insurance. Four, it repealed taxes that helped pay for Obamacare. Five, it eliminated the Cadillac tax, which had not gone into effect. It had been pushed out into the future, but it eliminated it. And then six, it allowed for health savings accounts, HSAs, to be used for over-the-counter medications. Okay, interesting. Okay, now, what was not included in the Americans Healthcare Freedom Reconciliation Act? In other words, what was not being repealed, or in other words, what was being kept? So what was being kept is, number one, Medicare modifications, such as value-based payments. So this is a huge deal, right? Because one of the central tenets of the Affordable Care Act was that it was not going to add one dime to the deficit. But there was increased spending on Medicaid and insurance subsidies. That was a lot of money. So where did the money come from to pay for the expanded Medicaid coverage and the insurance subsidies? Well, where it came from was Medicare. They were actually going to decrease Medicare reimbursement to doctors and hospitals. And so that decrease in Medicare reimbursement, again, it's out in the future, but it's already starting to go into effect. That has not been changed. 2, require insurance companies to cover adult children up to age 26. Again, this is actually a very popular part of the Affordable Care Act. That was not part of the repeal. In other words, they were planning on keeping it. Number 3, guaranteed insurance or guaranteed issue for insurance on exchanges, regardless of medical history, right? This was the whole challenge prior to the ACA of people with pre-existing conditions would either have insurance coverage completely denied, or they would not be able to get coverage for that, that particular pre-existing condition. So that particular piece of legislation that was attempted to be passed in the past was not going to repeal these things. But, of course, almost everyone on the phone here is an employee benefits professional, and so is obviously very concerned about the employer mandate and the individual mandate as well. But what about the employer mandate? Well, there is actually an agency in the government called the Congressional Research Service, or CRS for short, and it actually is closely tied to the GAO, the General Accountability Office, and the CBO, the Congressional Budget Office. And it's actually an internal policy analysis organization, or think tank, if you will, specifically for Congress. They essentially really dissect the nuances of legislation or proposed legislation, which is important, right? Because some of these bills are like 25,000 pages long, and not everybody reads everything that's in it before it is debated and goes into law. So in other words, the Congressional Research Service, they're responsible for actually reading the legislation before it's passed. Right? That's the sort of famous line from Nancy Pelosi back in 2010. She said, well, we have to be able to pass the ACA before we read the ACA, which seemed a little counterintuitive. So anyway, this Congressional Research Service actually read through all of that proposed act in 2015 that got vetoed, and it said specifically in their analysis of that legislation, 1, it would repeal the individual mandate, right? Because obviously if you get rid of the tax penalties on individuals, it's essentially getting rid of the individual mandate. 2, it would get rid of the employer mandate. The proposed legislation would get rid of the employer mandate. It would get rid of the excise tax on high-cost employer-sponsored coverage. In other words, it would get rid of the Cadillac tax. It would get rid of the medical device tax, and it would also get rid of what was called Prevention and Public Health Fund, which was about $930 million a year to go to the Centers for Disease Control for extended public health programs. So how would this actually, if there was going to be some sort of repeal and replace of the Affordable Care Act, like how would that mechanically happen? And so, 1, a repeal bill would need to be drafted, it would need to be introduced, and then it would need to be passed by the House and Senate, and then that bill would need to be signed by the President. And as far as actions that have already been taken in that direction, President Trump's first executive order was to minimize the ACA's economic burden. So it was a directive to the Department of Health and Human Services and the other parts of the executive branch, separate from an actual act of Congress or a law or a legislative change. These were executive branch changes. And in it, there was also a quote-unquote declaring war on high-cost drugs, and a statement that the new plan should provide access to affordable, quality health insurance and remove the penalty for not having insurance. And so one of the critiques of this executive order is that it actually created more confusion as opposed to less confusion. So, the point of today's webinar is not to predict the future, because I certainly do not have a crystal ball, and I am not in the fortune-telling business. So I certainly am not going to try to say for sure what is going to happen. But at least this is what has happened so far, and this is what would have to happen if there was going to be a legislative change. So in order for the law provisions to go into effect, the best estimate, the law would need to be passed, signed, and then the law provisions would need to go into effect. So in other words, once it's signed, not all the provisions would kick in right away. And so the best estimate from people that are familiar with how these laws are written and go into effect is that they actually wouldn't go into effect for the next 2 to 4 years. And it's unlikely that any major changes would happen in 2017, especially because a lot of the existing insurance contracts are actually already in force. So there is not a belief that there would be a lot of actual change in 2017 in this year itself. And that some changes may begin on the individual market as early as 2018. So you say, okay, fascinating, Eric. What are the implications of the repeal and replace, or the act that was passed in 2015, should it go forward? So one, it would affect these minimal essential coverage plans. So Compass has a lot of clients, and certainly there are a lot of employers out there who historically, before the ACA, did not provide any insurance at all to their full-time employees, and they were over 50 employees, and so now they had to provide insurance, and many of them provided minimal essential coverage plans. There are also many employers that for certain bands of their employees offer major medical, but then for other huge swaths of their employees, they historically had offered just indemnity plans, but now, and then they today offer minimal essential coverage plans. And so this is where those employers may, if you go to the last bullet here, if legislation similar to the Restoring Americans Healthcare Freedom Reconciliation Act is put into place, employers that offer minimal essential coverage plans may offer different indemnity plans or stop providing health insurance. So in other words, those minimal essential coverage plans, they have to have some things that are just part of the ACA, such as preventive care covered at 100%, coverage for ER visits, etc. So they would have more flexibility in terms of what that plan would look like. So depending upon which side of the coin you look at it, that could either be a good or a bad thing, or they might just stop providing health insurance at all. They might go back to their pre-2010 days and say, well, look, historically we did not provide health insurance, and so we may not provide this type of insurance going forward. Of note, there actually has been some Compass is in contact with some lobbyists that have their ear in Washington, specifically around healthcare, is that actually by giving employers more flexibility around indemnity plans and what were similar to minimal essential coverage plans, that more employers may move in that direction away from their major medical, because as we all know, the ACA did very little to address employer healthcare costs continuing to escalate, and so to the extent that these healthcare costs become untenable, that the expansion of these MEC plans or indemnity plans may be an option for employers and employees. Implication number two, no, the Cadillac tax will go away, right? 2018 and 2020, so it has been pushed back. So if the cost of health insurance continues to rise and employers choose to pay more and more for employee health care coverage, they will not be penalized. So this is where, large unions like the SEIU and many other organizations that had and promoted very rich benefits for their employees, they were anti-Cadillac tax because many of those very rich benefit plans were going to be taxed. And so this way, they can continue to provide those rich benefits, and it's, in essence, as those rich benefits become even more and more expensive as healthcare costs continue to rise, those benefits will not be taxed. So the big catch-22 there is that the Cadillac tax was, so David Cutler is this economist with Harvard, and this was essentially the Cadillac tax is not very popular with Republicans or Democrats. It essentially was sort of an academic's attempt to put in a policy change, because wages historically in the 2000s and the 2010s had been flat. And it had been sort of correlated that employers were just having to spend more on the health insurance for their employees, and money that they could have used on wages was instead being used on health insurance and benefits. And so the attempt of the Cadillac tax was actually to kind of put a cap on that contribution to health insurance and employee benefits, so that employers would instead use that money on wages. That was the theory. But a theory in academics doesn't necessarily play out in the real world. And so that's where the Cadillac tax was essentially on a bipartisan basis sort of unpopular with everybody. That is, it had been pushed back, and it likely will go away. Implication number 3, the individual market. This may be obvious to everybody on the call, but I just want to go ahead and spell it out. An individual market with guaranteed issued coverage, but no penalty for not buying insurance, would likely result in people with major health problems purchasing insurance, but healthy people being less likely to purchase insurance, right? That's the sort of complaint of the young and the healthy is that, well, this health insurance is so expensive, even with the subsidy, sometimes it's very expensive, or, if they're a sole proprietor and they make enough to not have to qualify for a subsidy, maybe it just was, astronomically expensive for them, family of four, $24,000 a year for health insurance, it might have just have been prohibitive for them. Those healthy people would maybe say, hey, I'll just take that $24,000 and I'll just set that aside for if I need health care coverage, or health care, but I'm not going to use that to pay for insurance premiums. So you would enter into this, the quote unquote death spiral of the young healthy people opting out of the insurance, the people who were sick and unhealthy, of course, buying the insurance because they needed the coverage for it, and then the health insurance premiums for individual policies on exchanges would rise even faster. Because essentially the healthy people were subsidizing the unhealthy people. So it'll be interesting to see what happens. Again, I cannot predict the future, but that is a potential implication. Implication number 4, future change. Okay, so employers may be skeptical about repeal and replace policies that they will remain in place for long. So there could be a new Congress in as few as 2 years, and there could be a new president in as little as 4 years. So it's like, okay, well, whatever changes happen now, how do we know that they are actually going to stay there? Or if they put in changes that don't even take effect for 2 to 4 years, then you could have a new Congress and a new president that could even stop those things from happening before they even go into place. So we were in one direction prior to ACA. Then we went in another direction with ACA. Now we're going in another direction now. Who's to say that the ping pong ball won't bounce back again? It's unknown. And so with that, I do want to briefly tell you that how we've seen Compass then support employees and their families through these changes is through a combination of things. So one, we've really seen that the Health Pro consultants that interact with the employees and their family members, there's a picture of one of them, that's Lauren there on the left, that the confusion around healthcare is more than ever. So we have not seen a lessening in that confusion. 2, the implication of the Affordable Care Act really not decreasing healthcare costs. We've seen a continued escalation in general of healthcare trend. And, as you've seen from the Kaiser Health stats, 29% of employees now are on a consumer-directed health plan or high-deductible health plan, which was up from like 24% the year before and up from like 2% in 2007. So the trend towards HDHPs and CDHPs continues just because healthcare cost inflation and mitigation just has not happened. And so essentially employers and their broker benefit consultants position Compass as the tool or the mechanism to go along with that plan design change. And then 2, you see the smartphone app there because we now have a smartphone app too, just because we live digitally mediated, smartphone mediated lives, right? You have a bank, but you have a banking app. You go shopping, but you also have a shopping app. You need to get from point A to point B. Well, shoot, you got an app for that now as well. And so now there is there's obviously a digitally mediated app way to interface with Compass as well. And as many of you know on the phone, our services are specifically trying to address the administrative pain points for employees and their families. So we'll load the SPDs into our systems to help folks, and we even do open enrollment support to help them understand their benefits and their plan choices along the way. Finding physicians, help them on their prescriptions, which also in 2016 we saw a lot more opportunity for prescription drug savings because as many of you have seen as well that the prescription drug costs have escalated at a faster rate than any other part of healthcare. So our savings per solution for prescriptions is actually more so than any other type of solution that we do. connecting employees into the right program at the right time. We essentially load all the different benefits, whether it be telemedicine or healthy pregnancy program, a wellness program, et cetera, into our system, client by client, so that we can refer people into those programs at sort of a teachable moment. And it's actually been a very great way to integrate all the various benefits, which again, navigating healthcare has become, if anything, more complicated rather than less. So we definitely see our members continuing to have challenges around that. Comparative shopping for medical care in terms of cost and quality, which we still do, and then certainly resolving problem medical bills. It's been a problem in the past and continues to be a problem and a growing problem for folks as they move to CEHPs and HDHPs. Again, we are super excited in 2017 to have our Compass Health Pro Cloud smartphone app. We've essentially taken the expertise and really the competence of a health pro and then put it into an app. We call it technology with a human soul. Here's just a quick screenshot of it. I don't want to stereotype, but I will say that a lot of our older members, I say that with quotation marks, and like folks in their 40s, 50s, and 60s, they like to talk to the health pros on the phone just because they tend to have more sort of complex healthcare situations, and they're like, hey, I'm Joe. I take these 3 medications. I got this bill from a physical therapist sitting on my desk, and I'm really looking for a new primary care physician. Then that's a very open-ended conversation, and we can kind of work through all those different ways that we can help them. But frankly, with a lot of millennials, they don't necessarily want to talk to anybody. They're kind of used to interacting with the world kind of through their smartphones, and that's totally fine. I'm not making a judgment about that. And so this is where now they can actually look up prices and do physician search. They can see their benefits on the Compass app. But if at any point they feel like they're getting snagged or things are getting too complicated, they can actually directly contact their health pro, and if they're specific assigned health pro, through the app as well. So it's like, I don't know if it's an MRI with contrast or without contrast. I'm feeling a little lost here. They can just click a button and they can connect with their health pro so that you can get more of that personalized support with a person as well. So we're super excited to be able to let you all know about that. And so with that, I also want to close with information about our Compass blog. So it's a blog that we write about 1 to 2 entries per week. It has a continued growing membership. I think we had over 100,000 unique viewers in 2016, which was like 40 to 50% more than it was in 2015. So your continued viewing of the blog is incredibly appreciated. You can subscribe to the blog as well. So you can get it through the LinkedIn Price Transparency group, or you can actually subscribe, and then once a week you just get a summary of all the blogs emailed to you, so you can just go to the blog, and of course you can unsubscribe it at any time. And I would say too, lastly, that if you would like copies of these slides, then I'd be happy to send those to you. Just email me at ericb@compassphs.com, and we'd be happy to send you back the actual slides from today. And then you can see the address for the blog down there, compassphs.com, for our website. And then you can also, for those of you that are on Twitter, you can follow me at Dr. Eric B. As well. I'll say too that 2 journalists that are really good to follow, that literally they on Twitter and just through their journals that are fantastic are Dan Diamond with Politico, and he is just at @DDiamond on Twitter. I mean, literally on a daily basis, he writes about healthcare policy, so he's fantastic. And then another person is from ProPublica, and it's Charles Ornstein, Ornstein, and he's at Charles Ornstein, Ornstein, first name Charles as well. Both of them, they tweet and they write extensively about healthcare policy. And then the last piece I would add is Kaiser Health News as well. So obviously there's a gazillion sources out there, and oftentimes folks just say like, hey, who should I go to for some sources? And I would recommend kind of those 3 places as additional resources that I personally find useful and you might find useful as well. And so with that, we will conclude today's webinar. And I will thank you all so much for your attendance. I will tell you that this week's blog also has those list of additional journalistic resources for healthcare policy changes as well. So that's another reason to look at the blog. But with that, I wish you all the very best and have a fantastic rest of your week.